Hello there. It's been about 2 months since we have had a chance to speak with Dr. Paula Stewart, who is the Medical Officer of Health for the Lanark, Leeds, Grenville District Health Unit. So she's with us today, and let's get an update as to what is happening with respect to the COVID-19. Dr. Stewart, nice to see you again.
Yeah, really nice to see you.
So please bring us up to date as to what is happening with COVID-19 and the vaccinations in our area.
Yeah. So for COVID infections, I think when we last talked, we had a few that we were still surfacing, but then we had a spell between sort of middle of July to middle of August when we had very few infections, which was really, really nice, because then it meant that our staff could get a little bit of a break, and people in the community could get a bit of a break. And then from mid-August till now, we have anywhere from about 10. We have 12 active cases right now. Remember, active is the 10-day period.
Yes.
So we have one or two, maybe 3 a day, sometimes none. So just small amounts. It's our same pattern where most of the time people are getting infected outside of the region, then come back into the household, no mask, close contact, or the virus spreads. And also, if there's small social gatherings, the virus spreads. So it's our same pattern. The numbers are low though, and we're not seeing. We've had a couple of workplaces where there's been one or two, but it hasn't spread beyond that. So all the precautions that we have in place outside the households are holding up. Which is exactly what we want going into the fall, because the Delta variant, which was just starting when we left off at the beginning of the summer, is now dominant in Ontario. And we absolutely have had some of our people have had the Delta variant as well. And it is much more transmissible. The virus has managed to change just enough that spike protein that goes into the cell gets in so easily now that it multiplies really, really quickly in many cells. And it means that when you're infected with the virus, you are giving off a lot of virus. And if people come in close contact, it's spread more easily. They're developing symptoms more quickly. So that's a change. So we're being very respectful of the Delta variant. It really is so important to be wearing your mask when you're inside, keeping distance. If you're vaccinated and you're going interacting with someone who isn't vaccinated or could have COVID in a really serious way, then really be careful. Make sure you're wearing the mask the whole time. Make sure you're keeping the 2 meters distance.
Yes.
So it's just our reality now. We know what to do. We just have to do it well.
Right. Do we have anybody that is in the hospital with COVID?
Not right now. We have had someone, but not right now. We're clear right now.
Good.
There are lots of people across the province, though, that have COVID
yes.
And are in the hospital.
But our area seems to be doing okay, though.
Yeah, we're doing well.
Let's talk about the children 12 years and over who can have the vaccination. Now, will the health unit be going into the schools to administer the vaccination?
Yeah, so we've had a wonderful response from our community. We're at almost 93%, 92.5% of our 12 plus population has the first dose, and we've got almost 87% have had the second dose. We are at the top in the province. We've had such a wonderful response. And with our young people, we have 83% of them have had the first dose, the 12 to 17, which is huge. And we're at 73% now have had the second dose. So what we're going to do, we're going to be going into the schools to offer the vaccine clinic right in the schools. The parents have to sign a consent form when it's in the school. If the young people come out to one of our clinics, then they can make an informed consent on their own. But in the school, the parents need to give us the consent form. So we're going to be going in to the schools to try and boost that 83% up to 100% and boost the 73% up to 100%, because it's really going to make a difference to young people if they're vaccinated. So if there is a case in the classroom, if they are 14 days plus double vaccinated, they stay in the classroom. They don't have to isolate. If they're not fully vaccinated in the 14 days after the last one, then they're going to have to be home isolating for the 10 days, missing school, picking it up virtually or whatever. So it's really, really important that young people are fully vaccinated. It means that we're going to have decreased transmission within the schools. The classes are going to be able to be functioning like they want to. The clubs, the extracurricular activities, all of those, the sports, all of that good kind of stuff can happen with precautions in place. So it's all based on really having a very strong foundation of the precautions with the masking and the physical distancing and the screening for symptoms beforehand. And then we've added in the extra individual protection with the vaccine. So I'm hopeful that we'll be able to keep those schools open and kids will be learning all year.
Now, there has been talk provincially that once the children do go back to school, that there's going to be, they have a projection where they feel that the number is going to start to rise as far as those that are going to be getting COVID-19. What do you see in our area here? You said that you were quite hopeful that people are, the students are going to be able to function okay within the schools as long as they have their vaccination. What do you predict for our area here? Do you think that we're going to have a problem?
Yeah, really good question. So far, when we've had a big surge of cases, it's really related to specific events. Yes. And you'll remember that over the past year, where there is a lot of people in close contact, precautions aren't in place, and the virus spreads really easily. So I think the best thing we can do is to avoid those situations where we don't have masks and we're in close contact and someone who has COVID comes and then it spread easily. So that's it. I think we know what to do. We need to do it. I think that the Delta variant definitely poses a really significant threat because it enters the body so quickly. The virus multiplies so quickly, and there's so much virus that is shed. So I think that the vaccine and all the precautions are absolutely critical. We don't have as many places where people congregate like in buses and in subways and in really large workplaces. So I think that our environment gives us a little bit of protection, but not total protection. We still have to take it seriously. And I think that as a community, I think it's really important for all of us to really do everything we can to keep those kids in school. They've lost so much.
Yes.
And I think it's a commitment I think that each and every one of us can be making, so that we decrease the chance that we become infected and that we don't spread it to others. So it's up to us.
Yes,
we've done well before. I think we've had those super spreader events. Let's just avoid those, and let's see how it goes.
So the vaccination center, the vaccine center at the Memorial Civic Center has now closed. So where do people go if they want to have a vaccination?
Yeah. So we closed all of the fixed sites at the end of August because we just weren't getting the volumes through there. Before we would have 800 or 900 a day, and then we're having 100 a day. So we didn't need that huge big setup, and Brockville needed to be able to use their rink for other kinds of things. So in Brockville, we've moved the site back to the health unit. So we've taken our biggest meeting room. It's all set up. And we are hosting clinics in communities around Lanark, Leeds, and Grenville. So the best thing to do is to go to our website. All the clinics are listed, the place, the time, and you can sign up for a clinic through Pomelo, or you can just walk in. Like, that's been a big change since we last talked. And I think it's really made a difference. At the Brockville Clinic, I think we had about 250 appointments on the Saturday. And then there were another 130 or so people just walked in. So I think that there are places where you can get it, go to our website. The other really important place is pharmacies.
Yes.
Half of our vaccines are now being given in pharmacies, and they are spread all across the region. So I think that's look for our clinics and also look for the pharmacies. Primary care is also providing vaccine to people. So you've got 3 places. And so there's still lots of opportunity to get the vaccine.
There was talk of a booster, the third vaccination. Is this booster specific to certain individuals, or should everybody have this?
No. So at this point in time, the province has decided people whose immune systems aren't functioning very well, given the Delta variant, which can really give an overload to your system. Just imagine all that virus coming in. For people who would have difficulty mounting an immune response, they're recommending a third dose. So those are people who have transplants and are on immunosuppressive therapy, so they don't reject the transplant. People who have hematological malignancies, so those are malignancies of the immune system, so leukemia, lymphomas, and people who are on anti-CD20 agents, which actually target lymphocytes. So those groups are all about not having a very good immune system. And the feeling is that if we boost them, and people who are in long-term care and high-risk retirement homes, because they're older, they have chronic health conditions and won't develop an immune response. So those are the very specific small group that can have the third dose. And then the National Advisory Committee on Immunization is reviewing all the evidence worldwide about whether a third dose is needed. And I think we haven't been very long with our 2 doses when you think about it, so I think so we're still having a good immune response, and they'll be looking at the research and seeing whether there's evidence that there are some other groups that could benefit from it.
Yes.
But for now, it's just that very select group. And almost all the long-term care and high-risk retirement homes we're giving the vaccine and they're doing the third dose themselves. The high-risk retirement homes are one where there's a memory unit. And in a memory unit, it's hard to control people's movement. And so if you had someone became infected, it could spread easily.
Yes.
Or are attached to a long-term care home because the staff go back and forth.
Right.
So very select group right now.
Okay, thank you for that explanation. Passports. Now, it was it was rejected early on about passports, but now they're saying, well, you know what, it may be a good thing. And they're also saying that going to sports events or a lot of these where there's going to be large groups, you need to have a passport, you need to have identification that you've had 2 vaccinations, and of course you have to wear a mask and be cautious. So what are your thoughts about this passport? Is it going to be beneficial?
So I think that the motivation for it is the Delta variant, and that how easy that virus will spread with large groups of people. And they pick places where people often don't have a mask. So you imagine a social gathering, a wedding or something where people are there, and when they're eating, they don't have a mask. So they're looking at meeting places, they're looking at people, they're looking at inside restaurants where people obviously are not wearing a mask when they're eating. So they've really identified places where you could have large groups of people without a mask, and places where the Delta variant would move quickly. So it's very specific to the Delta variant and very specific to places where people congregate without a mask. Same thing with physical activity exercise gyms, where people don't have to wear a mask when they're physically active. So it's very limited to exactly what you said, those high risk places where the virus could spread really easily. And having people who are vaccinated means that other people have more protection, and it means that the employees have more protection. So I think that's the motivation behind it. And you're right. There right now, you can show your when it comes into effect on the 22nd of September, you can show your vaccine certificate that you've gotten. They're working on a smart card that will be an app that you download, and you just show it on your phone. And that smart card will have the same technology, so you could use it in other provinces, because this is happening in other provinces as well. If you have a medical exemption, then you don't need to be vaccinated. And then you would still have a check on your app. So it's what my understanding is, the smart card will be really simple: name, date of birth, make sure it's you. And then a piece of photo ID, so we're sure it's you. And then there'll just be a check on it. And whether the check is because you're fully vaccinated, 14 days after fully vaccinated, or a medical exemption, no one will know. And this is not labeling people as having a vaccination or not. It's a show and go kind of thing. And if you haven't been vaccinated, then you just don't go there. And you can do all the other essential shopping, that retail and so on that you need to be doing. So it's really adding extra precaution, as you said, in those places where the virus can spread easily.
Yes. Okay, now can we talk about something else now? The rabies vaccination clinic is coming up very quickly for dogs and for cats. I believe it's September 22nd and the 29th. Where will it be located?
So we are very fortunate to have vets that help us out with this. They only charge $20 for a vaccine, a rabies vaccine, which is a very good price.
Yes.
Very good price.
Yes.
So go up on our website, www.healthunit.org, and when it says the question box, say rabies vet clinics, and then it'll poke you right into the area where you can check and see one that's close to you. Please do it. It's actually required to have dog and cats immunized against rabies because that's a protection that prevents rabies from getting into people.
Yes.
So that if dogs and cats who could be out exposed to bats, we have rabies in bats every year, 2 or 3 bats, or a fox, a skunk, a raccoon, or another wild animal. If that animal bites the dog or cat and they're protected with the rabies vaccine, it doesn't get into us. So it's a really important part of the protection for us. We don't have a lot of rabies in wild animals, but they do in Hamilton and Niagara, and we could. The reason we don't have a lot, this is an added thing, is that the Ministry of Natural Resources actually puts out bait that has vaccine in it for foxes, skunks, and raccoons, so that they are protected also. So
that's great. Yeah.
Protect the wild animals, protect the dogs and cats. People are protected.
Yes, exactly. So now my understanding also is once they pay the $20, it has to be in cash, no credit cards?
That's right.
Okay, so cash. So Dr. Stewart, is there anything else that you would like to tell our viewers about either COVID-19 or the vaccination?
One of the things that we've had a lot of questions about is getting the vaccine when you're pregnant. And you probably remember we were talking and the vaccine hadn't been tested. And so we said, speak to your healthcare provider. Now we've got hundreds of thousands of people who are women who are pregnant, and we haven't seen any adverse, which really is important. And we're recognizing that COVID attacks the lungs. If you get serious COVID, it attacks the lung and you have difficulty breathing. Just imagine a nice big pregnant belly that also is pushing up against the lungs and makes breathing difficult. So that while you're not more likely to get COVID if you're pregnant, you're more likely to get more serious disease and more breathing difficulties simply because of all of that anatomy. So it's really good idea to have the COVID virus, the vaccine when you're pregnant. And there's a double advantage in that there's more evidence now that if you have antibodies against COVID and you're breastfeeding your baby, those antibodies actually go through to the baby. And we know that. That's one of the huge advantages of breastfeeding. It's nature's way to protect the little baby while their immune system is developing. So measles antibodies go through, and it looks like the COVID antibodies go through as well. So getting the vaccine actually helps you and helps the little one. And if you get the vaccine when you're breastfeeding, it looks like the vaccine doesn't go through to the baby, but the antibodies that you develop does. So I think that we've had so many questions about that on our website. So I thought I'd share that with people as well. Talk to your healthcare provider if you have any questions about that. But I love that nature looks after the little ones, eh?
Yes, yes, they do indeed. Yes, I agree. So Dr. Stewart, thank you ever so much. It's always a pleasure to talk with you, and thank you for bringing us up to date on what is happening in our area. Always a pleasure.
That sounds good. Good to be back with you.
Yeah, okay.
Bye-bye.
Thank you. Bye-bye.